Greater engagement in health is a term that calls for the engagement of the private sector as a whole in the health system. And for many years now, there's been an increased focus in health on how donors and governments can better engage the private sector to achieve greater health impact and scale, because we know that the world's most intractable problems really need the involvement of the private sector to help solve them. One that we've worked on recently in India is the realignment of incentives to strengthen quality maternal care. So in Rajasthan state, maternal mortality ratio is almost 50% higher than the national average, and private facilities are used for over a quarter of all institutional deliveries in Rajasthan. Despite this, the private sector has not been a focus of improved quality of care. So if India is to further reduce its maternal and newborn mortality rates, improving standards and quality of care in private facilities has actually got to be prioritised. So we found a way to align financial incentives to an improvement in healthcare standards, and we set up the world's first development impact bond in maternal health that leverages private investor capital together with development financing to address this very issue. So it's important to engage the private sector now and work with them hand in hand to design and deliver programs in the health sector. And the time really is now that we get to grips with how the private sector is going to work within the broader public health system in a way that further encourages the private sector to grow, develop and innovate, but still while meeting those essential pillars of good quality healthcare that everyone deserves.